You probably know February is Heart Health Month. That's winding down, but the time to raise awareness about heart disease in patients, big and small, really should go year-round. When we think about heart health, we usually think about adults, but it's something that also impacts kids. Here to tell us more about it is pediatric cardiologist Jill Shivapur. Thanks for being with us.
Thanks for having me.
So let's first just talk about this. We don't usually think about children when we think heart health. How common is it for kids to have problems?
Great question. Congenital heart defects are about a 1% chance in all babies who are born. And then children can also have acquired heart diseases from viruses or other infections.
So as parents, whether we're talking about a brand new baby, that at least I'll speak for myself, I was so paranoid about every little thing,
Yeah.
or toddler age kids or even older, what sorts of things should we be aware of and be keeping an eye out for?
Yeah, it's great to go to your primary care provider and make sure you have those well visits. At those well visits, getting to see similar providers allows them to listen to the heart. If they notice any changes with their breathing patterns or how their heart sounds, that's when they may have you see a pediatric cardiologist.
Sure, and a lot of this stuff that we're talking about is, something that can't be prevented. It's just what a child is born with. But there are also other ways we can help keep our kids healthy. What things should we be doing?
Oh, great question. So move. I think letting kids play, be active. It's great that we have all these fun electronics, but it's made people a little bit more sedentary. So with this wonderful weather we have in February, get outside, play while it's warm. When it's cold, see what you can do to move in the house or in your community. If there's an indoor place to get out, let them play with others or play with other family members. That's the most important heart health thing. And then lots of good, healthy fruits and vegetables, easier in Iowa when it's the summertime.
Absolutely, so true. When we're talking about any sort of red flag, if we have concerns as parents or caregivers, what then should we ask our pediatricians about? Is there, like a certain sort of test, blood test or screening test that could answer concerns that we might have?
Unfortunately, there isn't a great blood test for typical heart problems in children. If they're having, say, chest pains or odd heartbeat feelings, your pediatrician or family medicine provider may order an EKG. So that's the most common screening test. And then other tests that can be done are heart ultrasounds, things like that.
Okay, and then let's just talk grown-ups for a little bit since it is Heart Health Month. What's your main point that you want us to take away about keeping our hearts healthy?
Stay active and find something fun that you like to do even as a grown-up. I think going back and try to find other people to move with, friends, family, listen to music, go find something fun to do, and then just eat a wide variety of healthy foods.
Yep. It's a muscle. We need to exercise it, right?
Exactly.
Okay, doctor, thanks so much for being with us today, and we'll be right back.